What's going on, everyone? I'm very excited to bring you episode number 2, interview number 2 to my channel. I have on Andreas. He's a long-term friend of mine. I've known him since 6th grade, and he is a practicing clinical psychotherapist with his master's degree in social work. We discuss his educational background as a Florida State student and also a UPenn master's student, as well as discuss the integrations and the collaborations between psychotherapy and psychiatry, MD versus his master's degree. And we finish off with some mental health talk about how medical students and how pre-med students and doctors and residents and everything in between can obtain mental health, and he gives some advice for you guys looking to seek that. So I'm very excited to bring you this interview. Enjoy it. If you like these videos, make sure you comment down below in the comment section, like the video, and subscribe. Enjoy. What's going on, everyone? Welcome back to my channel, and thank you for clicking on this video. For those of you who may be new to my channel, my name is Terence. I'm a first-year medical student. If you're new, make sure you subscribe and like the video if you enjoy these videos. I'll be putting out weekly videos just like this every single week, so make sure you come along for the journey. I have a very special guest. This is interview number 2. Very special guest, Andreas. He has his master's in social work. He is also a certified personal trainer, a long-time friend of mine. I can tell you from the beginning, when I met Andreas, we first met, I think, in 6th grade. We were on the same football team. And then we rekindled back in high school and had a bunch of classes together all throughout high school, played sports together. And I can tell you that he's always been somebody that has like a next level intelligence, has always been somebody that is well-spoken, more conscious in his thoughts. So I really am excited to have this conversation. He practices now as a clinical psychotherapist. Is that correct?
That's correct.
And I want him to talk to you guys a little bit more. He also has a business that he just recently started, Purpose Coaching and Consulting. So I want to have him discuss more about that. And so, Andreas, introduce yourself, talk about your educational background a little bit and your current career.
Let's do it. Dude, I'm so happy to be here. It was exciting. My name's Andreas. I went to Florida State for my undergrad. I got my bachelor's in social work. Didn't always know I was going to be a social worker or a therapist. That was part of the journey as well. So for like the med students listening, probably have something similar. Maybe didn't always know from the beginning, but that's all part of it. So I got my bachelor's down there. With the social work programs, you have to do a field placement. So I had to do one for my master's and my bachelor's. So my field placement in undergrad was working as kind of a counselor in a middle school in Tallahassee. So working with middle school age kids who were at risk, fights, some substance use, maybe come from lower socioeconomic backgrounds. So trying to mitigate some of those factors and build on their strengths. And that's one of the core tenets of social work, working with people's strengths, where they're coming from. So after undergrad, I got accepted to UPenn. So I'm like, all right, probably can't pass this up. And I heard you talk about finances too and how that influences your decision-making. So that's another one. It's like weighing the immediate cost versus the long-term benefits. And in my mind, long-term benefits would inevitably outweigh the immediate cost. So did that. It was an accelerated program because I had my bachelor's in it. And while I was there, I worked as a psychiatric social worker at Friends Hospital. So inpatient, working side by side with psychologists, medical doctors, psychiatrists, right? And helping people on their lowest days. I was in the intensive adult unit. So we saw a lot of co-occurring issues going on at the same time. That was an experience, and I'm sure I'll end up talking about that a little bit more too.
Sure.
But then I moved down to Tampa. I'm working in a private practice, and I started my own business. And yeah, that's where we're at.
Awesome. So this wasn't planned, but I heard you talk about the low socioeconomic status students that you were working with back in Florida. Did that influence you at all to want to be in Philadelphia and work with a similar, diverse and sometimes low socioeconomic status population in Philly?
To me, I think it adds a sense of challenge because it's not just the symptoms that meet criteria to get a diagnosis, to get an appointment in the first place.
Right.
Because I know that's where like the medicalization of psychotherapy kind of comes into play too. When you're working with people who have other extenuating circumstances that make even getting to that appointment difficult.
Right.
Well, then there's different things that we have to look at. Well, how does poor diet, nutrition because of low access to high nutrition foods come into play? How does maybe fearing for your safety because it's not the safest of neighborhoods come into play? How does substance abuse, family conflict, problems with the education system come into play? So
Right.
there's a lot more to explore. And working in North Philly, well, yeah, all those things kind of come together too.
Hmm.
So
Absolutely.
definitely a part of it.
So I want to hear a little bit more about your business. I heard you talk about your 6 pillars before to the company, and I want you to go through that now with us, kind of introduce those 6 pillars, and I want to focus on one specific one, purpose, once you get to the end.
Yeah,
So please go through them.
awesome. So number one, confidence. If we don't have a belief that we could achieve our goals, whatever those goals might be, more often than not, we're not going to achieve them. If you go in with that sort of negative mindset, maybe you're reflecting back on other times where you haven't been successful. Well, that's something that we got to overcome first. If you don't buy in, if I can't get you to buy in, right, I can't build that rapport, that's on me. And that's okay. But we got to have that confidence first. And then you got mental and physical wellness, 2 separate pillars, but they kind of coincide. Mental wellness is, well, how do you perceive the world around you? How do you respond to external stimuli and manage that stress? And the physical wellness is, well, are you taking care of yourself? Are you getting adequate sleep? Are you eating? Are you staying hydrated? It doesn't mean that you have to be in the gym 7 days a week. Quite the
Right, right,
opposite. Finding literally anything that works for you that keeps your body moving.
right,
I'm sure you could speak to this too, right? There's physiological changes when you are active. We were
right,
designed to be active,
right,
right? And then, well, you got communication. Just being able to articulate what you're thinking and what you're feeling. Most people know how to talk, right? We could do that. It's how do we put precisely what we're thinking and feeling into words, not just for ourselves, that's important too, but so another party gets where we're coming from. We don't leave people the opportunity to assume what we're thinking and we're feeling, because that causes conflict as well.
right,
And that goes right into, well, relationships. How do we balance changes in relationships? How do we look at different dynamics of different relationships in our lives? Not always just you and somebody else. It's you, somebody else, the situation in which you're interacting, the circumstances with why you're interacting. What do you seek to gain from this relationship? How is this a back and forth? How do we make it equitable?
right,
And then, the pillar that you wanted me to really emphasize, well, purpose.
right.
I like that word. I love that word. That's why I named the business after it, because it touches on a bunch of different stuff, right? Like you could look at overall sense of purpose on a grand scale. Like, why are we here? Well, to me, I'd like to think, well, try to make the world a little bit better if we can. Do no harm, right? The Hippocratic Oath.
Yeah,
Last thing we ever try to do is to make somebody's life worse. So that's a big thing in the grand scheme of purpose, for me at least. But also, like, why am I doing what I'm doing? When I wake up, when I roll out of bed, what is the purpose behind me either maybe drinking a glass of water and going out and getting some air versus me staying in bed for another half hour scrolling through social media?
right.
Why am I doing what I'm doing? Why am I thinking what I'm feeling? And why am I thinking what I'm thinking or feeling what I'm feeling?
Right, right, right. Yeah, I think those are all great things. And one thing I want to talk about with the purpose, especially just identifying where your impulses are coming from and identifying, I guess, how to make a sound decision. As people that are studying to be doctors and somebody that's studying to be a doctor myself, I always think about how can I make the most rational decision based off of the circumstances, as you talked about, just being able to balance, myself, the patient, what the patient is going through, and be able to use that to make a sound decision. I think is one thing that's very, very huge. And we're going to talk about self-evaluation a little bit later, but just all those things, I guess, tie together. As a med student right now, I feel like my job is just to absorb everything. I feel like I'm just a sponge in a huge soaking bath. I'm just supposed to be absorbing everything. And one of the reasons why I want to make this channel and want to have conversations like this is to be able to absorb and learn things from people outside of my direct profession and just gain expertise from different angles and become a well-rounded individual and eventually, practicing physician. You're also a certified personal trainer. And one thing that I like to focus on it, or when I was a personal trainer, one thing that I had noticed is there's such a huge gap. And that's why I asked you the question. There's such a huge gap between different areas of expertise. You have somebody that's a certified personal trainer, and I have a lot of experience in orthopedics. So, I would be shadowing an orthopedic physician, and they would be saying, hey, before we do the surgery, or to help your symptoms in your knee pain, lose 20 pounds. And then they'll just let the patient go.
Oh,
they won't
just lose 20 pounds.
Yeah, they won't, they'll say, take a class, go to the gym, but they won't give them a diagnostic or prescription to like go see a personal trainer. So I felt that, why is there this gap in these two professions? And I just feel like there's such a gap in certain elements of healthcare. Do you feel like there's a gap between psychiatry and psychotherapy in any way, or do you feel like it's closely related?
Oh, they're closely related in the matter of dealing with, DSM, Diagnostic Statistic Manual diagnoses, right?
Right.
So, whereas, social workers, mental practitioners, any of those certifications just below, like the MDs, the psychiatrists, we're taught to look at the person in their environment. That's class number one, right?
Right.
Look at these other circumstances. Micro, the person individually, the meso, their immediate community, and the macro, which is society as a whole, legislation, right? Things that impact people on a grand scale. Right. Psychiatrists, some of them are great at looking at what we look at, 100%. But some of them see, okay, they hit 5 out of these 9 criteria, so they meet the criteria for the diagnosis, and let me go over here. All right, I'll prescribe them this. Follow up in 3 months. So you kind of need that collaboration, just like an orthopedic surgeon with a personal trainer. That comes down to networking. That comes down to trusting the network that you are referring to and knowing that they are competent enough to be of help to this person.
Right. I 100% agree. And I think that that's one of the reasons why I wanted to kind of open up these communications, because unless you have a communication with somebody like this, like, when you're in medical school, you're just so focused on learning the information and being the best at understanding and diagnosing patients. And obviously there's certain things like bedside manner, but you can't do everything in a 15-30 minute visit to the office. So there's certain connections that you have to have in orthopedics, personal training, strength and conditioning coaches on call, ready to go, just like you have another doctor on call, ready to go if you need to refer a patient. Same thing with psychiatry, psychotherapy, and everything in between. So that's, it's so shocking to hear that from different, hearing from different tiers, like, why don't you have more collaboration? I think it would just make everybody better. Like you said, do no harm, help the patient get better. It's bigger than just one profession and one lane, for sure.
Oh yeah. And like, we can talk about insurances too, how you say it's hard to do those things in a 15 to 30 minute session. Well, yeah, I see people, sometimes I see them once a week. Some people I see every other week. Some people I see twice a week.
Right.
For an hour of a clip. It's like 15, 30 minutes. When we're beholden to insurance covering certain things, and they'll only cover a certain span of time for certain things, well, then we have to throw a label. We have to throw a diagnosis, and we can't explore what is contributing to this diagnosis in the first place. But that's one of those macro overhauls that I think we as a country need. Right. And that's a much longer conversation.
Absolutely. I want to switch gears here to one of the last topics that we'll discuss, and that is medical student pre-med and even going up higher to physician and resident level mental health. I recently made a video on this. It hasn't come out yet, but hopefully it'll come out before this interview comes out. But as pre-med students, we kind of have this athlete mentality almost, where it's kind of like grind. Push through it. It doesn't matter as long as you get to the finish line. I had that same thing as a pre-med student when I was studying for the MCAT, burning out, losing connection with friends and family, hurting relationships, because you are so focused on this one goal, getting to that championship, getting over your hurdle. For a lot of people, the MCAT, a lot of people, your grades, extracurriculars, those are the things that are stopping you from getting to your end goal. And we just think push through it. And there's so many misconceptions, I heard you talking about it before, and I'll let you expand on it. Just the idea that if you're a med student, you have to get pimped by your attending physician, pretty much asking you these hard questions, put you on the spot, make sure that you're always ready. Just this rigor and this feeling that you have to get embarrassed in order to really learn. And it's because we're just doing things through cycles, just cyclical nature, and may not be necessarily what's the best for everybody. So I want to hear you talk about that. What you think as far as, do you feel that there needs to be more institutional, I guess national institutional implemented things for mental health for students, and even personal attention to that as medical students? So any advice for us?
Yeah, I think it's absolutely necessary. It's such a complicated juggling act because in one regard, yeah, I mean, we got to be able to thrive under pressure.
Right.
You got someone coming in, say you're an ER doctor, I couldn't imagine, right?
Yeah.
You really got to be on point. But now I'm wondering, well, is embarrassment, is being overworked, is being sleep deprived the best way to meet that goal?
Mm.
I would much rather have, if I'm working with someone doing their residency, I'd rather have somebody who's well rested,
Yeah.
who feels comfortable going to their superior with problems and not feeling like they're going to be accosted for going to their superior with problems,
Right.
than someone who thinks like, man, I have to take it all upon myself right here. And then, I don't know, trying to be empathetic as well. It's like, well, imagine how much strain this person brings home with them if they don't have the time or the resources to spend time with their family and friends.
Mm.
That's got to be horrible. You live in a bubble and you have no choice but to burn yourself out if that's the only gear that you could run at.
Right.
I think there should be free mental health care for all students, ideally all people, right?
Mm.
I think that should be a kind of a government subsidized thing, getting more into the macro issues here. But there's no reason why someone can't get help, or even with this COVID now,
Mm-hmm.
that someone has to die because they can't afford health care.
Yeah.
Or someone has to drive themselves mad because there aren't any mental health resources.
Right.
But
yeah.
Speaking on the stigma too, like athletes, we had similar coaches, right?
Yeah.
We come from the same place. That sort of demeaning motivator is not the best.
Yeah.
Yeah, we want to push through. We want to think, oh, just man up, get through it. If you're a woman up, get through it, right?
Right.
It's okay to seek help. It's necessary to seek help. It's more than okay.
Mm-hmm.
It doesn't make you any less or less qualified.
Yeah.
Not the case at all.
One thing I was thinking about recently, actually, just thinking about athlete mentality, I'm grateful for a lot of the grit that I'm gotten because it's helped me push through, put my head down, kind of stay in my lane. But at the same time, it's like you realize you have to unlearn a lot of things. You take things for what it is and then unlearn the bad things and the bad habits that come along with it. I want you to, one last thing, to talk about your experience at UPenn. You said you had taken a class for mental health preparation. Talk a little bit about that. And I hope it's something that a lot of schools offer, but I want to harken on that one experience you had.
Dude, it was one of the best experiences I had there. So it was at the Perelman School of Medicine, mindfulness-based stress reduction program. So it was completely for how do we get better at being in the moment,
right?
Non-judgmentally. How do we take in our surroundings? How do we take stock of what's going on in here and up here too? And not allow those to influence producing the best possible response in those situations. And that class was awesome because I was with med students. I was with MBA students at Wharton.
Mm-hmm.
I had the opportunity to collaborate with people outside of my school.
Mm-hmm.
And just seeing the difference in myself and seeing the difference in my classmates, because we would be in small group discussions. We would learn about actual neurochemistry behind it too. It's not just sitting in a circle humming with our eyes closed.
Yeah, it's not like a hippie situation.
Nah, it could be. If the principles are the same, it could be, but that's not the case. It's very evidence-based.
Right.
Which is what we got to be.
Right.
So that was mind-opening.
So that's everything I have for you. Is there anything that any advice you would give to a pre-med out there or a medical student or anybody in between that may be, striving through right now, studying for the MCAT, trying to, stressing over their applications? Any advice you would give them to kind of keep them at ease and bring them back to kind of that center point?
Yeah. Make sure that you take time for yourself. Even if it's 15 minutes a day, something where you could tune out the outside world and do something that brings you genuine happiness, not for anyone else's sake, but for your own. It's super important. And even if you're just at the beginning of your journey, like, you'll get there. When you're looking at it all right in front of you, like, I have to do this, so on and so forth, it could be overwhelming. Take it piece by piece.
Right.
You've done it before throughout your lives. From 5th grade to 6th, going into middle school, 8th to 9th to high school, getting into undergrad. You've done it. You can do it, and you will do it. Yeah, that's
Awesome.
my piece.
That's perfect. That's beautiful. Especially for me about to start medical school, that is exactly what I need to hear. Taking time for myself. I went into this summer kind of thinking, when I go into medical school, I'm going to do it my way. I'm not going to do it how everybody else told me that I should do it. I'm going to do it my way on my terms and, take control of my life. So I think that's the best advice you could give anybody. Thank you so much for coming on to the channel. I really, really enjoyed this conversation. We're going to talk more after this, but I really enjoyed this conversation. Thank you for everybody that is watching right now. Please go check out Andreas's website and his business, Purpose Coaching and Consulting. Also go check him out on all his social media platforms. They have on Instagram as well. Do you have any other, do you have a Facebook group or anything else that I should?
Yeah, on Facebook, Insta. Yeah, Purpose Coaching and Consulting. All around.
Beautiful. Thank you to everybody that's watching.
Dude.
Good luck to everybody with applications to MCAT. If you're watching and you're going through it, make sure you keep that mental health in check. It's not always about the grind. Good luck to everybody, and let's get it.